Why a common knee surgery may be doing more harm than good. A long-term clinical study has raised serious questions about the effectiveness of partial meniscectomy, one of the most frequently performed orthopedic procedures for knee injuries. The findings suggest that instead of providing relief, the surgery may actually lead to worse long-term outcomes for patients. The study, Surgery versus Sham Procedures, researchers conducted a 10-year trial to compare the results of patients who underwent surgery to trim frayed meniscus tissue against a control group that received sham surgery, a procedure where incisions are made, but no actual repair or trimming is performed. The study followed 146 patients, aged 35 to 65, across 5 Finnish hospitals. The participants were divided into 2 groups. The surgical group received a partial meniscectomy to address meniscus tears. The control group received a placebo sham procedure. The results were striking. After a decade of follow-up, the patients who underwent the actual surgery reported poorer overall knee function, faster progression of osteoarthritis, a higher likelihood of needing even more surgeries in the future. Understanding the meniscus and the incidental finding, trapped to understand why this matters. It is essential to understand the anatomy involved. The meniscus is a C-shaped, rubbery pad of cartilage that acts as a shock absorber between the thigh bone and the shin bone. When it tears, either through sudden sports injuries or gradual wear, it can cause pain, stiffness, and clicking sensations. However, a significant complication in modern orthopedics is the role of MRI technology. We now know that these meniscal tears are very frequently found in patients with no symptoms. Notes Prof. Teppo Jääväinen of the University of Helsinki. Because MRIs are so sensitive, they often detect tears that are incidental, meaning they exist, but are not actually the cause of the patient's pain. This creates a diagnostic trap. Doctors may see a tear on a scan and assume it requires surgery, when in reality, the patient's pain might stem from something else entirely. A medical reversal in progress. Prof. Jääväinen describes these findings as a potential medical reversal, a phenomenon where a widely accepted medical practice is eventually proven to be ineffective or even harmful. While the data is compelling, the medical community is not in total agreement. This tension is visible in the current landscape of orthopedic care. Changing guidelines. Many experts, including Mark Bowditch of the British Orthopaedic Association, note that best practices are shifting. Surgeons are now encouraged to think before they strike, often waiting 6 months for physiotherapy to work before considering surgery. The persistence of tradition. Despite the evidence, major organizations like the American Academy of Orthopedic Surgeons, AAOS, still endorse the procedure. This highlights how difficult it is for the medical establishment to abandon long-standing surgical norms. Exceptions to the rule. Experts suggest that while surgery is unpredictable for general pain, it may still offer predictable benefits for patients experiencing specific mechanical sensations, such as the knee physically catching or locking. Conclusion: the decade-long study suggests that for many, trimming the meniscus provides no benefit and may accelerate joint degeneration, while surgery remains a tool for specific mechanical issues. The medical community faces a growing challenge in distinguishing between actual injury and incidental findings on an MRI.